Welcome to the See Jason podcast. I'm Andrew Vissing from Northwestern University, and I'm excited to talk about our recent study, Bridging the Gap, Assessing Nephrology Transition Practices in Pediatric and Adult Medical Centers. Let's start with the big picture. The transition from pediatric to adult care is a crucial and often challenging time for young adults managing kidney disease. They're not only navigating new healthcare teams, but also taking on more responsibility for managing their condition, sometimes leading to disruptions in care along the way. In our study, we set out to evaluate how transition practices are handled across pediatric and adult medical centers for both general and transplant nephrology programs. What we found was striking. While transition guidelines exist, like those from the International Society of Nephrology and the International Pediatric Nephrology Association, the way they are implemented varies significantly. Some centers have well-established transition clinics, while others have no formal protocols for transitioning young adults at all. This inconsistency can lead to fragmented care, increasing the risks of non-adherence, hospitalizations, and even poor outcomes like graft loss for kidney transplant recipients. To investigate this further, we conducted a nationwide survey and received 188 responses from adult and pediatric nephrology and transplant nephrology programs. The results highlighted many gaps and opportunities to improve care for these patients. For instance, only 20% of programs reported having a dedicated transition clinic, and 32% had no formal clinic or protocol in place. One of the most surprising things we found was the disconnect between pediatric and adult programs. While many pediatric programs reported having protocols, their adult counterparts were often unaware of these practices, or lacked similar structures altogether. This disconnect underscores the need for a more unified and collaborative approach. Transition clinics, when they exist, offer real benefits. They are linked to better long-term outcomes and fewer hospitalizations. But there are barriers to their establishment, financial challenges and resource limitations being major ones. Interestingly, we found that adult nephrology programs were more likely to see these clinics as unnecessary, which highlights a difference in how pediatric and adult providers view the importance of transitions. Both groups, however, agreed on an issue: the need for a dedicated adult provider to champion this vulnerable population. At the end of the day, our study underscores how critical it is to have structured, intentional transition practices. By standardizing protocols and improving communication between pediatric and adult providers, we can make a real difference for young adults with kidney disease during this pivotal stage of their lives. Thanks for tuning in. If you're interested in diving deeper into this topic, check out our article for more details.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.